Hi, I'm Dr. Greg Castello, board-certified family practice with CastelloWellness.com, and we're going to do an Ebola virus for October 8th of 2014. I told you I'd come back if we had an update, and indeed there are a couple of interesting updates. First off, Thomas Duncan, the man who traveled from Liberia, came ill in Dallas, Texas, has now died today. So he originally traveled from Liberia September 20th. He was not ill at the time. He had several stops, including a 3-hour layover in Washington, D.C., before he landed in Dallas and became sick on the 25th, was seen in the emergency room, sent home with a bacterial infection, put on antibiotics, and returned by ambulance a couple days later, deathly ill. He just died this morning of complications of Ebola virus. His family is still in quarantine, as are 38 other people, including a gentleman who was transported in the ambulance after he was. So far, none of them are sick, but they're talking about a 21-day isolation period before they may show signs of symptoms if they were infected. Now, he was well when he traveled. I'm told that the patients or people who leave Liberia are screened for fever, and they are asked a questionnaire, and apparently he lied on the questionnaire. He had taken care of a woman in a taxi cab who was pregnant and vomiting, and maybe had some bleeding on the 19th, so that probably was his exposure to Ebola before he left, was this woman in the taxi. So far in the United States, we've had 5 people that have had Ebola virus. 3 were aid workers, physicians that got sick in West Africa treating patients were brought here. Those 3 people are home and all have made a full recovery. There was a World Health Organization worker who September 19th was transported to the United States with Ebola, and there's been no information about that patient. So they may have died, they may have gone home, but they're not releasing any information about that patient, so we're not sure. And then lastly, the NBC cameraman who was covering in Liberia was apparently not very close to direct patient care, also came down with Ebola and is now in the United States undergoing care as well. The most interesting thing of today is in Spain, a nurse has been infected, caring for 2 people that were brought to Spain from West Africa to be treated. Now, she was not in Africa, she was in Spain and got the infection there. So this is the first confirmed case of someone who actually has not been in the endemic or hot zone area and received it as a second exposure from someone transported out of the country. Now, that said, the doctors who were treating the patients who were brought here with Ebola knew of the precautions. They wore the spacesuits and still got Ebola virus. This nurse had what apparently at this point we're told was adequate precautions, and she got the Ebola virus. The cameraman probably did not have direct contact with bodily fluids as a cameraman, and he contracted the Ebola virus as well. So the question remains, is this truly just an infection that is spread while you're actively sick, or can you spread the infection before you are showing signs or symptoms? And is it as hard to catch as we are told? Is it just blood and bodily fluids, or could it be in respiratory droplets? Could this be floating in the air when somebody coughs and you breathe the infection in? So at least 5 people now, healthcare workers trained in precautions and wearing the spacesuits who have received the infection. We're waiting now to see any of these 38 plus people in the United States if they come down with the infection, because it would be a much more casual contact than an aid worker or healthcare worker who had very obvious direct contact. So that's the news of the day. Not to panic at this point, but keep your eyes open. Thanks.